The gentlelady from Michigan, Ms. Dingell, for her 5 minutes.
Thank you, Mr. Chair, and thank you and our ranking for holding this hearing on the use of artificial intelligence in healthcare systems. Look, AI is transforming every sector, and we've seen that this emerging technology has the potential to transform lives and improve healthcare incomes, but let's be honest, with rapid advancements come serious challenges as well. Any potential AI-related legislation must consider potential data privacy, which I worry about deeply, algorithmic bias, displacement of jobs, and in the case of healthcare, misdiagnoses, and as our witness also said, the humanness of patients, and you need compassion and empathy. It's also important to highlight the context in which we are having this conversation. My Republican colleagues in Congress and the Trump administration have already enacted and seek to advance further reductions in staff and funding of our healthcare system. Adequate resources are critical to ensuring that the usage of AI technology in the healthcare space is subject to guardrails that protect the safety of the providers, the patients, and their loved ones. So, Dr. Mello, as providers grapple with the increasing presence of AI in their workplace, many worry that this technology jeopardizes patients' right to high-quality care and displaces our talented doctors and nurses. How can we ensure that AI serves as a tool that physicians use to enhance care, not one that replaces person-to-person care?
It's an important question, and the context that you specifically raise of cuts in Medicaid reimbursement just intensifies both the need for AI to augment capacity in rural and low-income hospitals and also the constraints around their ability to monitor it properly. I think there is a lot of promise in use of AI to address the needs of populations in those facilities, especially those with complex needs, but they will need help. And assuming, as many organizations do, that simply because there's a human in the loop, we don't need to provide support, training, and institutional level monitoring is a grave mistake. Let's not forget the whole reason that organizations are implementing many of these technologies, like scribes and note summarizations, is the burnout that afflicts those facilities. So these people in the loop, this is not Superman. They need support, and it has to be at the institutional level.
So let me take that one more step down. Many patients, particularly seniors and individuals with disabilities and children, as we're talking about, have unique needs that require knowledge and care of a human provider. What specific considerations are necessary to preserve the level of patient care for those with complex health conditions as AI plays a larger role in their care?
Well, as I think about that question, I have to start from where we are now, which is that those patients are in many ways really poorly served by the system we have in its extreme fragmentation of both care and information. So I actually think, to some of the testimony that other witnesses have given here, that those are some of the best opportunities for AI to make things better. But there are reservations that I have as well, in part because patients in that position are not themselves positioned to be good overseers of the AI that's being used in their care. For example, whereas I might be inclined to review an after-visit summary that I know an ambient scribe generated, somebody who's dealing with multiple complex conditions will not. And so we need to be extra careful about monitoring for them.
I have some thoughts, but I'll put them in another question. I'm going to have time for one more. I want to turn to the potential mental health impacts of AI, particularly on women and girls. We know that the victims of abusive AI-generated content, such as deepfakes, feel isolated and distrustful around them. We've already talked about depression, anxiety, suicide, etc. I was one of the proud leads of the Take It Down Act. But Dr. Wright, because I'm almost out of time, how can our mental health care system be bolstered to better respond to the impact of AI-enabled abuse?
Well, thank you for the question. I think in part it starts with helping providers, clinicians, and others really know how to evaluate the tools and what they should be looking for if they're going to incorporate these tools into any kind of setting that they're doing. And I think it's about helping clinicians and providers know what questions to ask of their patients about their AI use. I think a lot of providers have no idea where to even start to ask that question. And so you can't even sift out whether abuse is happening if you don't know the right question to ask. And so it's these sorts of things, whether they're continuing education trainings that providers get, or we think about how do we train individuals within the school settings, our future providers, because they're the ones who are really going to be up against it.
Thank you, Mr. Chair. I'm out of time, so I will
Yes,
yield back.
ma'am. Gentlelady,